Good afternoon, everyone, and happy Friday. We appreciate you spending what hopefully is your lunch hour with us today. My name is Alyssa Scarciotti. I'm the Clinical Education Manager here at Lexier Dental Laboratory Group. We have Emily Geisey, who will be sharing insights with everyone on mastering intraoral scanning for precise crown and bridge restorations. Just a couple little housekeeping items. We definitely encourage questions. We have a decent sized group this afternoon, which is awesome. So put any questions that you have in the Q&A section of Zoom. If for some reason we don't get to them, we'll definitely follow up with everyone at the end. But we love your interaction, any questions that you have throughout. So please feel free to put your questions in the Q&A. And just in terms of credits, you all will be earning 1 CE credit through AGD PACE for this session. We use Zoom just to keep with AGD compliance. So we do require a webinar to receive your CE credits. And those will be sent out via email through education@lexier.com within 2 weeks. And I just wanted to give a quick introduction to Emily. Emily is our resident expert with anything iOS and scanning here at the lab. So she's a great resource to us internally and a great resource to everyone that's joining today. So Emily has 15 years experience in the industry, 4 years dedicated just to scanning with us here at the lab. So she's incredibly knowledgeable, and please continue to catch any additional webinars or programs that she's offering. I'll hand it over to you, Emily.
Awesome. Thank you so much, Alyssa, for that introduction. Thank you all so much for being here today, spending some time with us. Hopefully you'll grab a few tips and tricks today that'll help you in your practice. So what we have on the agenda for today, we're going to first review scan settings very briefly. I think it's helpful just to understand the scan settings and how your iTero works. And then we'll dive right into the RX, which is truly a really important part. Communication is everything when you're working with your laboratory. So we'll spend some time talking through the RX. Can answer any questions there. And then we'll go into some just preparing to scan, good ergonomics. We'll talk about that. We're going to talk through tips and tricks for restorative scanning to get the best outcome. Then I'll do a live demonstration scan for you guys. And then we'll come back. We'll talk through our scan rating matrix that we utilize here at Lexier when we're reviewing your scans. And then we'll do some live review of some scans that we've received here. What's good, what's not good, what's going to, probably be pushed back to you for a rescan. And hopefully that'll be helpful for you when you're evaluating your scans before you send them to the lab. All right, so scan settings. So definitely double check your scan settings in your practice on your scanner. One key thing here is we want to typically your scanner set up for prep first and your prep jaw. That's how it's going to pop up. So it's not going to be your lower and upper if you're used to scanning in your iRecord, if you're doing like a wellness scan. So prep first, prep jaw first. And then this is the more important thing here, your guidance hints. So I always encourage offices to have this enabled. So that way, if you have a new staff member who is newer to scanning, you'll have those guidance hints pop up right away before you go into scanning to remind you to follow the right scan strategy there. And then I don't recommend changing any other settings. So I just wanted to point that out real quick. All right, jumping into the RX. So if you've been scanning for a very long time, the iTero has updated their RX slightly. If you're newer to scanning, then nothing's different for you. But for crown and bridge workflow, we're going to select our procedure type under fixed restorative. And then right below that order information, you want to allow enough time for the lab. So for your due date, you'll put that in and you'll select your lab under send to. Under the order information, we have our scan options, and you'll see that pre-treatment scan. You can toggle this over, and I just want to highlight this. You can use the pre-treatment scan for a couple different reasons. One example would be, let's say, the patient's in temporaries. They really love how they look, and you want the lab to mimic the design of those temporaries. You can toggle over pre-treatment scan. So you'll be able to, before you remove those temporaries, you're going to scan that upper, let's say it's uppercase, and we're going to scan the upper arch. We're going to scan the opposing, and we're going to scan the bite. Then you'll be able to scan all your preps and your prepped arch. Okay, so we can have it all in one file. You're not scanning for your crown, going back out, creating a new RX to add another scan. It's all in one. So that's just one example of why you could utilize that pre-treatment scan option, but it is there. So I just want to explain, why you would use that. Then when you're charting, your tooth diagram is going to pop up when you select fixed restorative. So if you go into your RX and you haven't selected that procedure, you're not going to see that tooth diagram right away. It will populate after you select fixed restorative. From there, you're going to select the tooth, and then you'll do your RX for that tooth, which we'll get into in just a second. And then below the tooth diagram, iTero now has the attachments feature. So if you're not, if you haven't seen this before, you don't know what this is all about, it is very helpful. So you can use it for a lot of different reasons. Obviously, if you have photos that you need to send to the lab, you can attach it and we will get the scan and the photos all at once, which is very, very helpful for us. If you're sending, DICOM, CBCT files, X-rays, anything that you're trying to send to the lab, you can actually upload with the attachments feature now. The key thing to note here is you can't do it directly from your scanner. So you will have to go to myitero.com, and you can do this from your phone or your desktop, and wherever those, let's say, photos are being stored. So you'll select from myitero.com this browse button here. You'll select your photos and you'll upload them. Then you'll go back to your scanner to send. So just a reminder, if you're going to send attachments, don't send the case to the lab yet. So you can put the prescription in, you can scan for the case. Before you send, just make sure you go to myitero.com, upload those attachments, and then you'll go back to your scanner to send the case so that everything comes all at once. Unfortunately, you can't go back as of right now to be able to add the attachments after you send those cases. And then, of course, all procedure types, you have the notes section. So the more information that you can provide to the lab, the better. So please utilize your notes if needed. All right. So once we select the tooth that we're working on, this is what's going to pop up. So we have posterior tooth options and anterior teeth options. Obviously, you'll have veneer and laminates on your anterior cases, but for today, we would either select crown at the top here, or we would select bridge. You can also chart your missing teeth. And then I just want to highlight this regular option. So let's say we charted a tooth, a restoration on tooth number 30, but actually it's 31. You can click on that tooth and hit regular, and it will take that treatment plan out so that you can put that on the correct tooth. Let's say it was 31. So you would select, for this case, we'll say crown. Then once you select crown, it's going to pop up like this, and we're going to have a couple different options here. So we're going to have specification, material, shade. When you select specification, you're going to have a drop down that pops up on the right-hand side here. It's going to say full contour, PFM/PFZ, and so on and so forth. So you would select from there, and then you would select the material type. So really important, they had updated this, I'd say, I think a year and a half ago. So make sure you're selecting the material type and really understanding what you're asking for. So just because we select full contour doesn't mean that the lab is going to do a full contour zirconia or crown. Do you want a translucent zirconia? Do you want an Emax? That's what you would select under that material dropdown. And then one other thing I like to highlight is PFM/PFZ. I wish they didn't lump these together. But make sure, I would just highlight in your notes that if you want a porcelain fused zirconia, put it in the note section. If you want a PFM, put that in your note section. And from the drop down, you'll have different options as well, but it's just a double check for the lab. So you can add that in your notes section. And then for PFM, if you have those cases, I think a lot of practices have switched over to zirconia and Emax. But if you're doing PFM cases, just also knowing from the lab side of things, are we doing a non-precious, semi-precious, high noble? So just making sure that we are aware of the correct material and charging you appropriately. And then the shade system. So if we're just doing, let's say, A1, you're going to put that in the body. Then you have the drop down below for additional information. And you can also let us know if you want different shades for the gingival and incisal. So you can put that in that drop down for the additional information. We don't necessarily need the prep and margin design if you don't want to, but if you'd like to add that for us, great. And then you have the stump shade option down here as well that you can see. So it does help your lab if you're doing an Emacs. If you can provide the stump shade, that's very, very helpful. And then for bridge charting, same thing. We're going to select that tooth. Instead of selecting a individual crown, we're going to select bridge. And then you will have that pop up again for bridge. You're going to select at the top here, what's the span of the bridge? So for this one, we put in 3 to 5. And then once we have the bridge span, we're going to select the tooth right here, and you'll have this pop up that you can see on the right. So we would select if number 3 is our abutment, 4 is our Pontic, and then 5 is another abutment tooth, or a Maryland, so on and so forth. And then same thing that we just reviewed. So we're going to put that crown information here. So the specification and material as well, along with the shade information. And then when we are done putting this information in, there's not a little button that says save. You're just going to hit the back arrow at the top left side there where it says bridge. You're going to hit that little arrow back, and it will save all the information that you just put in. All right, Alyssa, I think we have our first poll question.
Awesome. Very exciting. We're doing this to make sure everyone's not just snacking on their lunch over here.
Yeah, hopefully I didn't put anyone to sleep yet.
All right, so our first poll question. When
right.
reviewing your prep, make sure you're looking at the scan in color, true or false.
This is totally anonymous, so no one will know what you answer. This is just to see where everybody's at and what you think is right.
Yeah, 58%
participation.
participated. I know.
Yeah.
Yeah.
Keep going, everybody. Thank you. Thank you. Appreciate the participation.
Okay, so we'll end this, and Emily, I'll let you share the results.
All right. So kind of neck and neck there. We have 56% said true, 44% said false. So when reviewing your prep, make sure you look at the scan in color. So actually, which we'll talk about here shortly, you do want to look at that prep in monochrome because you'll be able to see your margin much better. Sometimes when you look at the prep in color, it looks like you can see the margin lines. And then when you look at it in monochrome, which is what your lab is looking at and designing off of that STL file, we can't really see the margin. So always good to look in that either stone view or monochrome view, which we'll go over shortly.
Awesome. Thanks, Emily.
Thanks. All right, let's see. Now, there we go. All right. So we went through the prescription. Now preparing, oh my goodness, sorry. Preparing for scanning. So just a reminder, this goes for anytime you scan intraorally. Just some key tips here, making sure that you turn off the overhead lighting. So the chair light, any loop light, you don't want any additional lighting. The scanner itself has light in it. So when you have more light, it's going to add to that reflection. And we don't want that. And then also having good ergonomics, don't kill your back and your neck. So I like to sit in the 12 o'clock position, having the patient laying all the way back. I have the scanner in front of me, so I'm not twisting around looking at the screen as I'm scanning, because you do want to get in a good habit. If you're newer to scanning, you want to make sure that you're looking at the scanner, not in the mouth as you're scanning. Okay, so just some tips there for when you're preparing to scan. All right, so we have our prescription. We're going into scanning. The tooth diagram, just going to highlight some things here. So when we select the pre-treatment scan, we're going to have, let's say our working arch is our upper. We're going to have a 1 and a 2 in that arch, as you can see here. So 1 is going to be your pre-treatment scan. So the example I was saying, if patient has their temporaries, they really love them, you want to send that scan to the lab so we can mimic that design. You'll have that pre-treatment scan. You're going to scan with the temporaries in on the upper 1. Then we would scan our opposing and our bite. And then the last two scan segments are going to be our prepped tooth scan, and then we will scan our prepped arch. Anytime that you're scanning the anterior, if you're doing some anterior preps and you're crossing that midline, always just scan the full arch. And it does really help your lab. So one, if you cross the midline, you got to get the bite on both right and left side. So when you just scan the full arch, you'll have more teeth to capture there when you're scanning the bite rather than capturing in the anterior, because ideally it's better to capture from first molar to canine. But also too, let's say we're doing number seven, we're trying to restore. If we can see the natural dentition on the opposite side, the lab can mimic that design when we're designing the crown for number 7. So if you can scan a full arch, please do, but especially when you're in, doing your anterior preps there. All right, so scanning sequence. Now this is as if we don't have a pre-treatment scan here. So as we talked about in settings, it's going to have you scan your prep first. Same principles apply when you're scanning your prep. So always get positioned. We're going to see, you can see in the photo here, and you'll see this when I do the live demo as well, that you have those green crosshairs. So before you turn the scanner on, you're going to line your prep up in those green crosshairs. This is going to represent your die. We want that nice and centered. Once we get positioned, we'll turn the scanner on, and we're going to go occlusal, lingual buccal, and then we'll just rock mesial and distal. We want to ideally scan the prep for only 8 to 10 seconds because we're working against the patient's environment, right? There could be bleeding, saliva, the tissue can collapse over the margin. So we just want to really make sure that we're not over scanning because that environment's going to be continuously changing. So 8 to 10 seconds, we're going to scan that prep. Not worried about the contact data in the prep scan. Once we have our prep scan, we can see our margins well. We're going to arrow over and go to the next section. We're going to scan the prepped arch, and this is where we're going to capture the contacts. Then we'll scan the opposing arch. Again, we're always scanning occlusal, lingual, buccal. That's how the scanner is designed. And then we're going to scan the bite. Please make sure you set your patient up in at least 45 degrees, and then we will scan that bite. Ideally, you want them get positioned, have them bite first molar to canine. As soon as those arches come together, you can turn the scanner off. Okay. You don't need to go all the way back to the second molar, and honestly, it could cause more frustration for you because it can force them to kind of open. It's a little bit painful. If you've ever been scanned before, then you probably know. So first molar to canine is ideal, but as soon as those arches come together, you can turn it off and you're good to go. All right, so one prepped arch, opposing, and bite. All right, so once we have our scan, we're going to evaluate. So we're going to go to that post-processing segment at the top of our scanner, and we're going to evaluate our scans. So a couple tools that we have on the iTero is your margin marking tool. What I will say is if you want to mark your own margins, you certainly can. Please notate it in your notes section so that the lab knows to go off your marked margins. And I will talk about this a little bit more and show you so it makes a little bit more sense when we do our live demo. But when you select that margin marking tool, it's going to auto-populate your margin for you. It is not 100% accurate. So you do need to evaluate that and adjust it if you are truly marking your own margins. If you accidentally select this tool and it auto-populates and you just back out of it, it still saves that and sends that to the lab. So you need to make sure that if you select this tool and you don't want to use that margin and you just want the lab to mark the margins for you, you have to hit that red X and delete the margin, and then you can go back. Okay, so I'll show you that when we do the live demo, and it'll make a little more sense. Then we have our prep separation tool. So always, always, always just click this tool, double check your prep separation. We want to include only the prep. We don't want it to include any of the adjacent teeth to the prep and the contact data. We just want that prep because, like we said earlier, if I'm scanning the contact data in my prepped arch and I miss that data in my prep segment, it's going to be missing when it comes to the lab. So we want to make sure that our prep separation tool. It's only including our prep only. It's not cutting off our margin. This is going to be a much higher resolution scan for the lab to work off of when we're marking your margin. So it's really critical that this is correct. So if you can simply check this for us before you send it, it is really helpful because we can't adjust this on our end. We either have to send it back to you to adjust, do our best with the scan, or send it to iTero modeling, which can delay the case a little bit. Okay. You also have your occlusogram. So checking your occlusal clearance, making sure there's enough clearance for the material that you selected. And then you also have your eraser tool. So if you need to adjust a little bit more, you can go in, circle the area where you need to reduce that prep a little bit more if it's just on that occlusal surface, but the margin looks really good. We want to lock that in. So we'll erase where we're going to reduce. We're going to hit that scan icon, which I will show you when we do the live scan here. So it makes a little bit more sense. And we will go back in and you'll see it circles just that area that we erased. And we're going to fill in just the data. It kind of looks similar if you're used to using the fill tool. Similar idea there. All right, Alyssa, our
Goal
next
number
poll
2.
question.
So let me just go back here. Okay. Our next
right.
goal is, in which scan segment should you capture contact data? So single choice here. And again, these are anonymous.
Yes.
We'll give it another minute or two, another 30 seconds.
Sip of water. Wait.
All right, I'm going to close it up here and then we'll share the results with everyone.
Right, perfect. So majority got it right. So it's that prepped arch segment that we're going to capture the contact data of the adjacent teeth to the prep. Okay. Nice job. All right, let's see. All right, so some tips and tricks for quality restorative scans. We want to keep the prep clean and dry. So either a 2x2, your air syringe, just making sure that's really nice and dry. So that the lab can see your margin to get a well-fitting crown. Again, just keeping that dry. So having cotton rolls, 2x2 gauze, air syringe, like I said, your suction. If you don't use a hemostatic agent such as Traxident, that's very helpful to control bleeding. Packing cord. I know it can be, maybe most offices don't do this, but especially if you have a subgingival prep, even if you don't, it still pushes back the tissue enough so that we can get a really clear margin. So a dual cord technique is ideal. And then you want to leave one and pull one right before you go to scan. Okay, that's best practice. Turning the wand off when we're scanning, you know, let's say we're scanning the arch, we want to not turn, we're going to scan occlusal, lingual, and buccal. If patient needs to swallow and we haven't maybe captured the buccal surface yet, just bring the wand out of the patient's mouth, let them swallow, and then go right back in and start scanning. Try not to turn it on and off. Unless, obviously, if we're scanning, we've scanned the opposing arch and we're going to the bite segment, at that point, that's where you would turn that wand off when you're scanning. We talked about the bite. So sitting that patient up to at least 45-degree angle when you're scanning the bite so that their jaw's not too relaxed. We want to make sure we have the proper occlusion, because if we don't, then your final crown may not fit and you may have some adjustments there for the bite. We talked about checking your prep in monochrome. So toggling over, I'll show you the tool when we do our live demonstration. So some offices just only scan in monochrome and they don't even scan in color. If that's what you'd like to do, please do. But you will be able to see your margins much better in monochrome. So always evaluate your scans before you send them in that stone model or monochrome view. We always want to check that prep separation like we talked about. It's all about the angle. So I'm going to highlight this a little bit more when we do that scan as well. But how you scan can affect the fit of your crown. So if you're scanning your prep and you're just going like this on the occlusal to try to capture the lingual and buccal sides, then you're probably going to have open margins. So rolling to be directly on the buccal surface, directly on the lingual, to make sure we have a very clear margin is really, really helpful. And then also doing that mesial and distal rock when we're about done to make sure we can see those margins as well. And I have some examples that I'll show you guys as well, also make a little more sense. And then we talked about anterior prep, so just scanning that full arch. Again, anytime you cross that midline, just scan the full arch. And if you'd like to just scan a full arch for all your cases, that's helpful too. All right. So retraction method here we did talk about. So dual cord technique. Also, your prep style does matter. I'm not here to tell you how to do your preps, but for scanning, chamfer is the recommended prep style. So that will help us to see your margins a lot better. Shoulder or a beveled shoulder is good as well. And we talked about that hemostatic agent. If you use like something like Traxident, that's very helpful as well. Definitely having packing cord. All right, and there's our prep styles. All right, so now's a great time for questions. I am going to back out of this, and we're going to do a live demo here. Just bear with me.
No questions as of yet, Emily. I'll keep an eye on it for you.
Okay. All right. Hopefully I didn't put too many people to sleep or lose anybody. All right, so we're going to select new scan. And we'll put our test patient in here. If the patient already exists, it will pop up down here, which is really nice. So we're going to load that existing patient so that it doesn't create a new patient folder. So if I want to use that time-lapse feature to compare scans down the road, I can, because it's going to save all my scans in that patient file. So here's our procedure types. So we have iRecord, fixed restorative, implant planning, denture removable, and appliance. So we're going to select fixed restorative here. We're going to put our due date in. You're going to select your lab. Again, this is our pre-treatment scan option. If we need to toggle that over, we can. You'll just slide it over and it'll turn blue. For today, I'm not going to. All righty, we're going to do number 3 here on my model. And this is where we're going to put our specification. So we'll say full contour, and then these are our material options. And if you're not familiar with your drop downs, you can actually add your favorites. So if I like to do translucent zirconia, I can do that. And then it'll add it to the top, so I don't have to scroll down this list every time. You can do that with your labs. Hopefully all your Lexier labs are favorited in your iTero, if you have one. So we will select the material. And again, you can see there's a lot of different options. So really understanding, the material. If you're not seeing the material, again, put it in the notes section. That's very helpful. So if you select zirconia, that's your full contour zirconia. If you do select a translucent, it is going to be a higher aesthetic zirconia for.
Sorry to interrupt, Emily. We do have a question, and maybe a technician question, but we'll see. For bridges, which material is best?
Well, I would say it probably depends on the case. Every case can be a little bit different. Full contour, we also have a Picasso zirconia. It's not a multi-layer. That uses gradient technology, so it's actually stronger than a regular full contour zirconia. So if you're looking for really nice aesthetics and strength, we have a Picasso zirconia that works very well. And you can do that even in a full roundhouse.
Great. Thanks, Emily.
I hope that answers. Yes, absolutely. Just interrupt me if there's any other questions too.
Will do.
Good question. All right, so we put our shade in here. Again, we can put a different incisal shade, gingival, again, stump shade if you provide that to the lab. If you're doing an Emax crown, that is very helpful. And then we'll hit that back arrow. Our tooth looks like there's a prep on it now. Our treatment information is saved down here. If we need to edit it, you certainly can. Show details, it'll bring it back up and you can change anything that you need to. Again, our attachments, it'll tell you, please go to myiatera.com to upload if you're adding any photos there. And then any additional notes that you'd like to add, again, the more information that you can send to the lab, the better. We appreciate it. Over communication never hurt anything, right? All right, so then at the top of the screen here, we're gonna hit our little scan icon. And these are our guidance hints that popped up. So that's what I was talking about in the settings icon, or in your settings, you're gonna select that enable guidance hints, and this is what's gonna pop up. So it's telling us that we're on tooth 3. We're gonna scan our prep first, and we wanna do occlusal, lingual, buccal, and then rolling onto the mesial and distal to make sure we can see that margin very well. And we're gonna get lined up first. I'm not gonna turn the scanner on yet. I wanna make sure those green crosshairs are nice and centered. Okay. I'm gonna turn it on. Again, I'm gonna roll lingual, and I'm gonna just show you. So see, I'm gonna leave my scanner on. I'm gonna turn this around. See how my buccal surface, I actually got a lot of data. My lingual got a lot of data, but it kind of looks a little fuzzy. So when I go back in and I roll directly lingual, see how much clearer that is? And then watch on the buccal side. So look at how much clearer that was. I hope everybody saw that. And then we're gonna rock mesial, distal, okay? And I'm gonna turn that off. I know that was a little longer than 8 to 10 seconds, but I just wanted to show that. So we wanna make sure that we can see our margins really well. This green dot, I'm going to make sure it's right centered. So by a couple things, when we talk about prep separation, if you line those green crosshairs up perfectly center on your prep, you double check yourself. Sometimes it's hard to get perfectly center. So then second step is that green dot. If you are pretty centered and you do those things, when you go to check that prep separation tool, it's usually spot on. You shouldn't really have to adjust anything. So just a little hint there. Okay. So we have our prep. We're not worried about the contact data at all. Now I'm going to scan the prepped arch. Okay. So we're going to start on that terminal molar. We're going to scan same pattern, occlusal, lingual. And when I'm on the lingual surface, I try to come down, sorry, my background, more vertical. That way I can twist to capture the contact data a lot easier, okay? And then on the buccal side, I want to stay nice and horizontal. You do not want to come vertical on the buccal side. You'll get a double set of teeth. And then I'm going to tip my wand out and back and do that rocking motion here. And then see how that dark blue filled in and I have that contact data. And I'm going to roll to the incisal edges here. See how it's like there's a gray line. I just want to point this out. Sometimes we don't always get the dark blue, but we have this gray line right on the incisal edge or the cusp tips there. I want to go back over that because I want to make sure that I have a really nice solid incisal edge. If you are, let's say you're doing a night guard, I know we're here for crown and bridge, but we're talking about it, so I'll say it. If you're doing a night guard and they're not fitting, or you're trying to do a retainer, a clear orthodontic retainer, and they're not fitting well, double check your scan because we really need to have a solid incisal edge. Just like you can get distortion and alginate in it, you can get distortion in a scan as well. So making sure that incisal edge is nice and solid as well is perfect, and will ensure that we have a proper occlusion. All right, so now we'll scan the opposing arch. Same thing, terminal molar here, occlusal, lingual, and buccal. I don't need to be perfect on the opposing arch. So if I'm missing a little bit of contact data, I'm not too concerned, but I want to make sure I have really solid buccal and majority of my lingual surfaces. All right. So we're going to sit that patient up at 45 degrees. Okay. And I'm going to scan the bite first molar to canine. And there, the models came together. The bite attached. I'm going to turn my scanner off. Okay. Sometimes if the scanner, your bite, I'm sure if you've been scanning before, that it doesn't attach to the models, which can be challenging and frustrating. Couple tips: go a little bit higher on the tissue and give the scanner a few more reference points. Just go up a little higher and down a little lower, and typically it'll all pull together. Sometimes too, just turning it off if you know you have enough data, turning it off, letting it think for a second, and then it'll stitch together. If it's not stitching together at all, you do just need to tap and hold on the screen, and then you have your options pop up here. We'll hit segment, delete that out, and we will scan that bite again. Okay. So once we have everything here, we're going to hit this little icon at the top to post-process. And this is where we're going to do our evaluation of our scan. Okay. All right. So we're going to check our prep, see if we have enough clearance. This one we do, thankfully. We're going to check our margin, but we're going to check in monochrome. So we're going to hit this icon right here, right below that, the arches on the left-hand side. Alyssa, I'm sorry to bother you. You can see my mouse, correct?
Yes. Yep.
Okay. All right.
Yes.
Just wanted to make sure.
It's small, but yeah, we see it.
I know it's so small. I'm sorry, guys. But this little icon here, so that's going to give us that stone view. We can see our margin very clearly, so we know we're good to go. If you cannot see your margin, the lab is not going to be able to see the margin. You can flip the model over in the negative. So if you're new to scanning for crown and bridge, and you're used to looking at impressions, you can actually flip your scan over and evaluate your margins this way. Okay. If you need to, this is really important. If you need to reduce your prep at all, you need to select the prep tooth here and then erase and rescan. If you scan your prep in the prepped arch segment, the lab's not going to get those changes, okay? Because it's overlaying your prep onto your prepped arch. So you have to make sure you make your edits from here. Did we have a question pop up?
Do you have a question? Yes. Adjusting adjacent teeth minimally, interproximal for better contacts? Question mark. Does that make sense? Adjusting adjacent teeth minimally dash interproximal for better contacts. Oh, yeah.
Yes. Evaluate your contacts, because especially if there's undercuts, please evaluate. And if you do need to make some minimal adjustments, evaluate if you can before you scan. That's great. Otherwise, just rescan your prepped arch if you need to adjust anything after the fact.
Great. And we have another question that came in. If occlusal clearance is adjusted after the prep has been scanned, should we scan over the new prep or delete the old prep and scan the prep again?
Perfect. I'm going to show you right now how to do that. So we need to reduce our prep. All right. We're too high. We need a little more clearance. I like to put the model, again, we're going to select, make sure you are on your prepped tooth only. Then we're going to select our eraser tool. I like to be on my buccal or lingual sides. Now, if I need to rescan the margin and everything, then you might just want to delete the whole prep, repack your cord, dry, retract, rescan. But if we just need to reduce on the occlusal and the margin looks perfect, right? Again, environments change where there's probably bleeding, the tissue's now collapsed, what have you. We're going to use this eraser tool, and I'm going to just remove the top surface that I'm going to be reducing. Okay. I'm going to, this little button on the bottom of the screen will lock your model. So you can flip this around. So I can see that I only erased the top portion. My margins are still good. I didn't erase anything on my margins. So now I'm going to hit this little scan icon where I selected my eraser tool. I'm going to select that. Now I can go back into that patient, reduce, and I'll get repositioned. It's basically, again, it's locking that surface. It's not going to rescan your margin. So if there's bleeding at this point, I'm not too worried about it because it's just going to capture the occlusal. Okay, I still like to roll a little lingual and buccal. Okay, I'll turn it off. And then it just filled in that data there. And then what I'll do is I'll go back to this post-processing. I'll check my clearance again. I'm good to go. Then we can move on. Sometimes it takes a second, so sorry. Been having some internet issues today, so it might take me a quick
That's
second.
a good time for our next question then while we're waiting.
Okay, perfect.
When do you suggest using the eraser tool versus the broom sweep tool?
Good question. So when I'm scanning, when I'm in my scan mode, you're going to have to use that broom tool to erase. When you are in post-processing, then you're going to use that eraser tool. So the only time I really use the selection tool is like if I'm having stitching issues or, you know, and I need to erase a certain area because it didn't stitch right. And then typically I use the eraser tool more because I can also be more, the word I'm looking for, definitive. You know, the broom, when you use it, it kind of like sweeps too much away sometimes. So I do like to use the eraser tool a little bit better.
Awesome. Thanks, Emily.
Yeah. If I'm not answering anybody's questions and or not making sense, please just ask your question again. And so hopefully that answered it for you though. Okay, so here we have, so below our eraser tool, now we're going to select we're going to check our dye separation. So this is where I was talking about. We want to make sure no contact data is present. We want just our prep. So I'm missing a little bit of the tissue. I'm going to be picky and I want to add that mesial. So again, this bottom tool, see how it's turning blue? That locks it so I can move it all around. I'm going to unlock it. Over here on my dye separation, I have a plus and a minus option. So if I want to add, I want to be on plus. If I want to subtract, I'm going to hit subtract. Okay, so we're going to add this in here. I'm going to make my line here. And I still want to include that tissue there. All right, so that's going to add that in. I want to re-add this part in here. Missed that. Okay, and then I'm going to lock my model again because right here, I want to make sure that I take that out because I don't want my adjacent teeth included. And I'm pretty sure when I scan the prep, I missed this part. So I don't want anything to be missing. Okay, so I want it just like that. And then I'm going to hit this little red dot there and I'll back out of it. All right. So that's how you evaluate your dye separation there. And then this tool on the bottom, this is our margin marking tool. Again, if you want to mark your own margins, you can. Please notate it in the notes to the lab. Usually I recommend don't even touch it. Don't even touch it. Just let the lab mark your margins. But ultimately that's up to you. So again, it's going to pre-populate where it thinks your margins are, but it is not 100% accurate. If see, I just moved that accidentally, but you're going to use the green dots to move that. If you need to add, I'm using my finger, sorry, I should use the mouse. If you need to add dots, you can, you just tap on you just click on the line and it'll add additional dots for you. But again, I don't really recommend this. If you accidentally click this tool though, you need to hit this X right here. It's going to delete out the pre-marked margin, and then you're going to hit that red dot again. Okay, it's going to close that out. Okay. And then if everything looks good, we're going to hit that envelope and send that off to the lab. Any questions? I'm going to back out of this and we're going to do some scan review. But before I do, is there any questions while I'm in scan mode?
Nothing that's come up.
Okay. Sounds good. So let me get back out of here. And bring back up the presentation. Bear with me one second. Am I okay on time?
Yep, we got about 15 minutes left.
Okay, perfect. I guess I just saw my timer there. I wasn't looking at it. Sorry. On my screen. Sorry. Okay. Oh, another poll question. All right. Last one. I don't know if people like these things or not, but
This is just a good little knowledge check.
yeah.
Okay. The gold standard for tissue retraction is to pack 2 cords and remove one right before scanning. True or false? We're paying attention.
Yes.
All right, we'll end this and we'll share the results.
Perfect. All right. Nice job, everybody. Yes, true. Gold standard, pack 2 cord, leave one and pull one. Very nice. All right. Do we have a question as well?
We do. Let me see. Okay. Is it easier to use the dye separation segment from the computer from myitero.com or in the iTero unit itself?
iTero unit itself. Yeah, you want to use it in I don't believe you're going to be able to adjust on your myitero.com. You'll be able to, you can add prescriptions on myitero.com, and you can evaluate the scans after you send them, but you will need to adjust on your scanner for the dye separation. Good question. All right, so we're just going to review some scans and then we'll wrap up. Continue to add in the questions as you have them. So here again at Lexier, this is our grading metrics on how we're evaluating your scan. So we have perfect, good, manageable, and rescan required. And there's our little sheet there showing that. So I'm going to just go through some cases so you can see here. So anterior preps. This one, they didn't quite scan the full arch, but we at least have enough data. And we can see that opposing side for the canine for design. And we were able to get a good bite on both sides. So this looks really good. So just a reminder there, if you can get us a full arch, that's great. So here's a perfect scan. You can see that tissue was retracted really well, and we can see the margin very well also. So that's what you want to try to see. Obviously, every patient's different, and if this prep is very subgingival, some of them aren't going to look as nice, but retracting as best we can, making sure it's very, very dry is really key. Here is another perfect scan that we have here. We can see that margin well, a little bit of bleeding on the distal surface there, but overall pretty good. And then this one, a little harder to see, but when you look in monochrome, there's a little bit of tissue overlap. So still a good scan, but a little bit of tissue overlap there. Right there, you could say. All right, so here's a manageable scan. And you can kind of tell it looks a little bit fuzzy. It's not as clear and crisp as the other scans were. So as I was scanning, when I showed you, it really cleared up there. Very, very important. Rolling, I would probably, if I had to guess, say that they just didn't roll enough on the lingual and buccal sides. I believe this, I know it's really close here, but it looks like at the lingual or palatal side. They just didn't be as direct. You also always want to make sure, I'm sure a lot of you already know this, but iTero is a touching scanner. Do not hover. It'll cause you a lot of frustration. So just be touching the teeth, being as direct as you can. It's all about the angles. Just keeping that in mind. So we would say this is manageable. We'd probably reach out to you and say, if we can get a better scan, that would be ideal. This is definitely a rescan required. There is a lot of blood, a lot of saliva, too much moisture. So this is what it looks like when you don't dry well enough. So just keep that in mind. We can't really see the margin at all. So that's what that looks like. And then here's another one. This was interesting. So this was definitely a rescan. We can't see anything. But this was most likely, it's hard to say when you're not right there watching somebody scan, but typically this is an overscanned case. So again, scan that prep for just 8 to 10 seconds. I apologize if you can hear my dog barking in the background. I'll just say that right now. I'm not going to ignore that. And then here is a
You can
is
barely hear it. I'm sure
okay,
you're
good.
hearing it more
Sorry, I
than
can
we are.
never tell. Sometimes it's like nobody can hear anything, and then whatever. It's life. All right.
Yep.
So this is a scan that we also received here at the lab. So there's definitely a very unclear margins and some distortion there. So we're not going to be able to give you a good quality restoration off of this. So just keep in mind, evaluate your scan before you send them in. I know we understand, obviously it can be challenging. Every patient presents differently. But even notating to us, if you know that there's something missing or it was a very subgingival prep, put it in the notes to the lab so that we know, okay, they did see this. We're going to do the best that we can for you for that restoration. All right, so closing out today, just want to highlight a few things of how we can provide support. Obviously, we can do things like this for you in your practice, and we can do virtual webinars or trainings. We also offer hands-on training. So I appreciate everybody joining today. I know it's hard virtually, so if you are looking for that hands-on experience, definitely please do reach out to us. We have many amazing trainers who can come to your office and provide support to you and your practice. If you're not connected with us, you can certainly do so and visit our website, lexier.com. You'll select submit your case, and then it will give you all the codes on how to connect to your scanner. And also, we don't just work with iTero, we work with all other scanners as well. So you can access all of this information from our website on how to connect with us via your scanner. And then here are some just iTero and Lexia resources. So technical support, Invisalign support, myitero.com, to access your portal, to add those attachments and view your cases if you're not familiar. If you don't use myitero.com, highly recommend doing so, especially scan evaluations with patients as well. If you're doing wellness scans in your practice, makes it a lot easier, and then you can move the scanner out of the room and on to the next, but still be able to view those scans. And then learniteroelement.com is a really great tool as well. So they have a wealth of resources for you guys to access. So, definitely check that out, especially if you're newer to scanning. And then our website too, we have a lot of great information on there. So please check it out. And that wraps up today. Thank you all so much for joining. I hope there was at least one or two useful nuggets of information that you got out of today. And if you don't mind, hang on for just 1 second, scan this QR code and please give us some feedback. We really value your feedback. And if you're looking for additional courses in the future, that helps us to be able to provide that for you. And any questions, Q&A session as well.
Thank you. Thank you, Emily. Yes, if there's any questions, we have we have a couple of minutes left, so we're happy to address any questions, but I will just give that QR code another plug, please. We definitely appreciate your feedback. We want to know additional topics you might like to see in the future. If there's anything differently we could have done on this course, please let us know. And we do have a couple questions coming in. Someone asked, can we go back one page? So we'll go back one page quick to those resources. And I can actually, we will be sending a follow-up email out to all attendees. And what I'll do is I'll get those links from Emily and we'll include those all there as well. But if you want to go back there for a minute, Emily, you can.
Yes. See, will it let me?
It doesn't.
Hold on.
There we go.
There we go. Okay, sorry. Trying to just arrow on the thing. I wasn't working.
But yeah, we can, I'll send all these links out and information, along with Emily's contact information, in the email. Chat is disabled. Yes, we do disable the chat. It'd be nice if recording could be shared. We will definitely share recording. So for all of our webinars, we encourage you to attend future webinars as well. We will send the recording and we will send it to those that were not able to attend. Those that we can see in Zoom who did and didn't attend. So you won't be eligible for the CE credits, but obviously there's a lot of great content in here. So anyone that registered and didn't attend, we have your email address, and everyone will get the recording, and those that registered, attended will get the recording and your CE certificates. So we'll be happy to do that. We'll leave another minute or so just if there are any additional questions. And obviously Emily has her contact information here, which will
Yes.
also be included in the email.
Yeah, feel free to reach out. Any questions, even if it's not, you know, if it's related to any other scanning workflow, implants, digital dentures is really big right now. So if you're trying to scan edentulous and dentures, happy to support there as well.
We will be offering a webinar next Wednesday at 7:30 p.m. in the evening on digital dentures. So that'll be presented in partnership with Dentsply on Lucitone digital print digital
Yes.
dentures as well.
That'll be a really good one.
Yeah.
Join if you can.
All right. Well, we'll give everyone yay, digital dentures. Yes, it's a hot topic.
Yep. It's very exciting.
Yeah. So we'll certainly have a lot more education around that as well. Well, thank you everyone for your participation and your time. We really appreciate it. We'll be getting out those resources via email, and hope everyone enjoys the rest of their weekend. Thanks so much.
Thank you.